As you know, millions of people are living with some kind of medical device implanted in their bodies. Every year, about a third of a million Americans have surgery to get a pacemaker implanted. About 1 million hip and knee replacements are performed every year. We're talking about things like cardiac stents and IUDs and artificial discs and screws and defibrillators. Patients going under the knife need to have confidence that they're getting a product that isn't likely to fail or get recalled and force them to have a second operation. But right now, doctors don't have the information available to tell which pacemaker has a failure rate of, say, 0.1% and which one has a failure rate that is 10 times or even 100 times higher. So I want to follow up on the question that Senator Murray asked about unique device identifiers. Mr. Canati, you work at the Office of the Inspector General for HHS, which recently released a report about Medicare's ability to track the performance of medical devices. What did you find about the cost to patients and to taxpayers when these devices fail prematurely?
We found that CMS could not, from the claims form or information alone, determine that amount. In doing really advanced audit techniques, we were able to determine that over a 10-year period, approximately $1.5 billion were paid for Medicare services related to the replacements, and that equated to about $140 million in beneficiary copay and deductible liability.
And that was just on just one kind of product, right? Just cardiac devices, just 7 of them.
That's correct.
And it was $1.5 billion and another $140 million out of the pockets of the patients themselves. So it seems that figuring out how to use safer devices and sorting out the safer devices from the less safe devices could save Medicare a lot of money and save consumers a lot of money and a lot of pain. And that's why back in 2007, Congress required that all medical devices be labeled with what's called a unique device identifier, basically a string of numbers and characters that tell the specific model and the specific manufacturer. But of course, those data are valuable only if we actually collect them. So, Mr. Canati, does the Medicare claim form that hospitals currently fill out include a line for the device identifier information that tells us what model of device failed and who made that device?
No, it does not.
Does the HHS Inspector General support adding such a line to the claim form?
We do.
All right. I was glad to see that the standards group in charge of updating the claim form added this line to the draft that it released a few months ago. So it looked like everybody was on board and this was about to happen. Last year, CMS also supported adding the device information to claims. But when the OIG report came out a few weeks ago, CMS said they were reviewing the policy. And then a few days later, CMS put out a new statement saying the device identifiers on the claim form would, quote, reduce Medicare costs by identifying poorly performing devices more quickly, true, and protect beneficiaries from unnecessary costs, also true. So great, looked like everybody was back on board. But then a few days after that, CMS put out another statement saying the policy is still under review and that the earlier statement was wrong. So Dr. Goodrich, you're the Chief Medical Officer at CMS. I'm hoping you can clear this up. Do you agree with the Inspector General's recommendation that adding device identifiers to the claim form would help reduce Medicare costs and protect beneficiaries from unnecessary cost and pain?
So first, I want to say that we very much appreciate the work of the OIG and this committee's interest in this issue. Patient safety as it relates to devices is obviously very important to CMS. However, at this time, I don't have anything else to offer besides that, because as is customary for new administrations, we are still reviewing this policy.
So, all right, let me just say, this should be a no-brainer. Your agency's own watchdog says you should do it. MedPAC says you should do it. Organizations that represent orthopedic surgeons, cardiac surgeons, thoracic surgeons all say you should do this. Adding device identifiers to claim forms has bipartisan support in Congress. Senator Grassley and I have been pushing this now for years, and I'll be blunt, we're going to keep pushing on this. It is time for CMS to step up to protect payments and to protect the Medicare system. Thank you, Mr. Chairman.